This is Raju sir, briefing you about the parotid gland. Hope this type of picture is giving you information about the eating. The people who are eating more than the requirement are considered as binge eaters. And certain things we know which will increase our saliva by looking and thinking about such a product or such a substance called as sialogogue. So now we can see these muscles. So eating can be called as the mastication. Here you can see the muscles of mastication are located in this region, and this is the ear. Nearby we locate a region called as the parotid region. So parotid region. This is a region called as parotid region. So we must know the details about the parotid region. The region consists of a gland and the structures which are passing through it. So now we'll go ahead. The structures enter and exit through a soft structure. That's a concept. And we must know the meaning. Meaning already we came to know. And the structures which are entering and exit through a soft structure, we'll see. The definition of this region. Facial line space which forms the bed for the parotid gland. So space, parotid region is a space. Now we'll see the boundaries of this region. Anteriorly, there is a posterior border of the ramus of the mandible. We can palpate even in our body. And medial pterygoid plate. Medial pterygoid plate, while studying normobasalis, hope you heard about it. And posteriorly, there is a mastoid process which can be felt behind the ear, and sternocleidomastoid as well. Above, there is external acoustic meatus. So these landmarks are described over the skull. External acoustic meatus and posterior part of the temporomandibular joint. And below, posterior belly of digastric muscle and stylohyoid muscle. Medially, styloid process, again on the skull, and styloid group of muscles. So again, you can locate the group of muscles. Here you can see the boundaries. We'll see once again. Here, the mastoid process, angle of the mandible. And here you can locate the zygomatic arch. So these are the boundaries. The medial boundaries can be located on the skull. Then the parotid duct can be seen, parotid gland, parotid duct, the accessory part of the parotid gland even. These two can be located in this diagram clearly. And we can observe the shape of the gland even, inverted pyramid shape. In the inferior sectional view, section gives the view of the parotid region. This is how we can see the medial side and the lateral side parotid space here, in which the parotid gland is located. Then again, the parotid gland is located here. This is a submandibular salivary gland. Parotid salivary gland we are studying now. In the parotid gland, the surface anatomy and location. Anterior to ear, we can locate it, and seek the angle of the mandible and the zygomatic arch. These landmarks can be located. Where we can go get the inverted pyramid shape. With these landmarks, it is palpable even. You can palpate it. The soft tissue, can palpate it even over the masseter. Then the largest salivary gland in the body, predominantly serous. We use the word properly. It is predominantly serous, not the serous. It's predominantly serous. In the shape, inverted pyramid shape with these landmarks, the external acoustic meatus, then the zygomatic arch, cheek, and the angle of the mandible. So there is an inverted pyramid shape. And weight will be just grams. As it is a gland, definitely it is less in weight. So 25 grams, locating just in front of the ear. Parotid gland. So shape, it's like an inverted pyramid with its boundaries. We'll see. As we imagine, the inverted pyramid is inserted just behind the neck of the mandible. In this way, we imagine. So just we can understand. The coverings are true capsule. True capsule is a condensation of fibrous stroma, and false capsule called as parotid sheath, splitting of investing layer of a deep cervical fascia into parotidomasseteric fascia, stylomandibular ligament. These two modifications we should notice about the false capsule, which is an investing layer of deep fascia, and the parotidomasseteric fascia is the superficial lamella, and the lower border of the zygomatic arch is attached to the. And the stylomandibular ligament, we know that it is the deep lamella and attached to the tympanic plate and the styloid process. And the presenting parts are apex, base, the superficial surface, anteromedial surface, and posteromedial surface. And borders are anterior, posterior, and medial borders at presenting. So you can see this is the apex, this is the base, the anterior border, the posterior border, medial border is inside, and the anteromedial surface and posteromedial surface are located here only. So medial to this cursor. Then the apex is directed below, overlaps posteriorly of digastric muscle. There is a carotid triangle even nearby. And the structures related with the apex are the cervical branch of facial nerve, the anterior division of retromandibular vein, and the formation of external jugular vein. These are the structures related with the apex, the cervical branch of facial nerve, anterior division of retromandibular vein, the formation of external jugular vein. Here the apex, the cervical branch, the facial nerve. You can locate from this diagram. Then here you can locate the external jugular vein, external jugular vein. Again, here you can locate the external jugular vein, and the anterior. This anterior branch is a posterior branch of the retromandibular vein. You can locate the retromandibular vein. Then about the base. Base is concave, directed upwards. Relations. There is an external acoustic meatus and posterior part of the temporomandibular joint. And structures at the base. The temporal branch of facial nerve. Definitely there is a temporal branch of facial nerve and the superficial temporal vessels. Here you can palpate even the superficial temporal pulse. Superficial temporal pulse just in front of the tragus against the back of the mandible. If you're keeping the finger, you can feel the pulsations. This is about the superficial temporal pulse. Then auriculotemporal nerve also located there only, just in front of the tragus. Then the superficial surface consists of structural relations, the skin, superficial fascia from superficial to deep, and the superior group of parotid lymph nodes, anterior branch of great auricular nerve, and posterior fibers of platysma, superior lamella, parotid sheath. I repeat, the skin, superficial fascia. Superficial fascia consists of the superior group of parotid lymph nodes, anterior branch of great auricular nerve, posterior fibers of platysma, and superior lamella of parotid sheath. Here you can find the superficial fascia, and just below it, the structures can be seen. And inferior view from superficial to deep. So these are the structures. It's the parotid gland, the deeper part, the superficial part, parotid duct, masseter muscle, the ramus of the mandible. Through the gland, we can reach the facial nerve. Now, the anteromedial surface. Posterior inferior part of the masseter muscle can be located. The ramus of the mandible, posterior border, and capsule of temporomandibular joint anteromedially, and medial pterygoid muscle. The outer lip consists of the branches of facial nerve, and the inner lip consists of the maxillary artery medial to the neck of the mandible. Here you can see the superficial temporal artery, this auriculotemporal nerve, superficial temporal vessels together. Here we are getting the sphenomandibular ligament. Here you can see the auriculotemporal nerve. Again, this is the neck of the mandible. Posteromedial surface. Let's say it's an extensive part. Structural lesions are posteriorly definitely mastoid process, including the sternomastoid and the posterior belly of digastric, the styloid process with its muscles, and the transverse process of atlas and rectus capitis lateralis. The deep to the styloid process. Again, there will be anteriorly internal carotid artery, posteriorly internal jugular vein. Between these both of them and the last 4 cranial nerves also can be seen. Means 9, 10, 11, 12 cranial nerves. Deep to the styloid process. And the facial nerve which pierces the upper part. So on the posteromedial aspect, there will be MCQ related with the facial nerve pierces on which surface of the parotid gland. So the posteromedial surface, and external carotid artery, it forms a groove over the posteromedial surface. Here you can see the posteromedial surface, external carotid artery. The 4 cranial nerves can be seen, 9, 10, 11, and 12 cranial nerves. And here it is the transverse process of atlas. There is an internal jugular vein. These are the structures related to the posteromedial surface. Then the styloid group of muscles deeper to it. Styloid process is here, and the group of muscles are located here. Styloglossus, stylohyoid, stylopharyngeus, and the stylohyoid muscles. Styloid group of muscles. Then the posterior view. You can see the posterior view. Posterior view can be seen here. Then the anterior border is a thin, rests on masseter muscle, separates the superficial surface from the anteromedial surface. Structural relations: zygomatic branch of facial nerve, transverse facial vessels from superficial temporal artery, and the upper buccal branch of facial nerve, the accessory parotid gland and its duct, and the parotid duct, the lower buccal branch of facial nerve, and the marginal mandibular branch of facial nerve. I repeat the structures which are emerging out from the anterior border: the zygomatic branch of facial nerve, transverse facial vessels from superficial temporal artery, upper buccal branch of facial nerve, accessory parotid gland and its duct, parotid duct, lower buccal branch. In between these two, we can find the parotid duct. I repeat, during dissection also, we'll trace the parotid duct. Just above it, we can find the upper branch of buccal branch of facial nerve. Immediately below it, we can find the lower buccal branch of facial nerve. And along with that, the marginal mandibular branch of facial nerve. Here we can get all these structures. This is the parotid duct, upper buccal branch, lower buccal branch, then the marginal mandibular branch, zygomatic branch, and the temporal branch. Temporal branch is not coming from the anterior border. And you can see the posterior border rests on the sternocleidomastoid muscle. Posterior auricular vessels and nerves are related with this one. And posterior auricular vessels and nerves can be seen here. Here, posterior auricular vessels and nerves. The medial border separates the anteromedial and from the posteromedial surface. There are the processes extensions from the gland itself, glandular tissue, the facial process, pterygoid process, glenoid process, pre and post styloid process. We'll see there is the facial process, triangular in nature. superficial to the masseter muscle, triangular, the facial process we call it, along the parotid duct, whatever it is there, we call it as say extension in the form of process, facial process. In the accessory parotid gland and its duct, the small part of facial process can be located along the accessory parotid or the parotid duct, detached from main gland. Main gland is away from the main gland, and between the zygomatic arch and the parotid duct. Between these two structures, we can find this facial process. Here you can see the facial process. Here you can see in the pterygoid process, it's a triangular in nature. Between the ramus of the mandible and the medial pterygoid muscle, you can find this process. In the glenoid process, direction is upwards between the external acoustic meatus and the capsule of temporomandibular. The glenoid process is nearby the meatus. The pre and post styloid process, nearby the styloid process, it makes a groove over the gland called as styloid process, and the pre-styloid in front of the groove and post-styloid behind. There is the internal jugular vein also. Then the parotid duct, also called as Stenson's duct, is the surface anatomy, can be traced middle third of the line extending from the lower border of the tragus to the midpoint between the ala of the nose and the red margin of the upper lip. It's very easy, and we can look at even in our body. The surface anatomy, middle third of the line, extending from lower border of tragus, then to the midpoint between the ala of the nose and the red margin of the upper lip. Between these two, the length will be 5 centimeters and the diameter is 3 millimeters. Diameter is very narrow, 3 millimeters, and formation, union of two vertical ducts, exit from the gland through the anterior border, the course on masseter muscle, then between the upper and lower buccal nerves, and runs abruptly medially, suddenly, buccal through the buccal pad of Pat, through the buccopharyngeal fascia, then the buccinator muscle, and finally opens into the mucous membrane. Here you can locate the course from the anterior border is exiting, and it exits from the anterior border and reaching over the masseter muscle. Suddenly, it's changing its direction and it's piercing the buccinator muscle and the buccal pad of Pat and the buccopharyngeal fascia, opens into the vestibule. This is about the cielogram to trace the parotid duct, can trace the parotid duct. Then the opening, it's very important to know the opening, commonly asked in MCQ. Open in the vestibule means open the cavity between the teeth and the cheek. On papilla opposite the crown of upper second molar tooth. Upper second molar tooth. I repeat, the opening of the parotid ducts is at the upper second molar tooth. Structure is inner mucous cuboidal epithelium it consists of, and the outer consists of smooth muscle. Here you can see the parotid duct in the form of a papilla. So small projection, mucus projection, papilla. Here upper second molar tooth. Here you can locate. Then the structures passing through the parotid gland. So these are the structures: facial nerve, temporofacial trunk, cervicofacial trunk, buccal, marginal, mandibular, and cervical branches. Then the retromandibular vein and the external carotid artery, which are passing through the parotid gland. Then the facial nerve. Few words about the facial nerve. It passes through the stylomastoid foramen, 2.5 centimeter deep to the middle of the anterior border of the mastoid process. Down and forwards 1 centimeter. It goes head and pierces the posteromedial surface and 1 centimeter within the gland, superficial to the retromandibular vein and the external carotid artery. And branches: temporofacial trunk, temporal and zygomatic branches, cervicofacial trunk, buccal, marginal mandibular and cervical branches. Pes anserinus. So goose foot appearance is called as, it's like a expanded goose foot. So that's how it is named as pes anserinus appearance of the facial nerve, its branches. So then the superficial and deep parts, the by branches of facial nerve, it is divided into superficial and deep parts, and it consists of the isthmus, H-shaped in coronal section. That's how we can see H-shape in coronal. Isthmus has been removed, so it is a part of the gland. Can be seen here. Then the retromandibular vein. Few words about the retromandibular vein. It's found in the intermediate zone, and formation is by the superficial and maxillary veins joined together. The branches are anterior plus facial becomes the common facial vein. Posterior plus posterior auricular vein becomes the external jugular vein. So simple. Common facial vein is formed by the anterior branch of the retromandibular vein. You joins with the facial together form the common facial vein. Sectional jugular vein is formed by the posterior branch of the retromandibular vein plus the posterior auricular vein joined together to form the external jugular vein. Then the external carotid artery, it's found in the deep zone. There are the terminal branches, superficial and the superficial temporal and the maxillary artery. External carotid artery can be seen here, located. The superficial temporal artery and the maxillary artery. This is the external carotid artery. The blood supply of the parotid gland, arteries by the external carotid artery as it's piercing through. Then the venous drainage through the external jugular vein into the external jugular vein. The lymphatic drainage into the superior and deep groups of parotid nodes and even to the jugulodigastric nodes. Here you can see the jugulodigastric nodes can be located here. And the preauricular and parotid lymph nodes are group of lymph nodes are located posteriorly also, anteriorly and inferiorly also. And the nerve supply, secretomotor nerve supply by the parasympathetic, which is responsible for watery secretions, and sympathetic responsible for mucus rich sticky substance. And the cauda tympani of facial nerve, and vasomotor by sympathetic nerves. And parasympathetic preganglionic fibers comes from the inferior salivatory nucleus to this through this tympanic branch of glossopharyngeal nerve and through the tympanic plexus and lesser petrosal nerve finally reach the otic ganglia. It's about the ganglion, preganglionic fibers. And what about the postganglionic? Postganglionic fibers will reach the gland through the auriculotemporal nerve. So auriculotemporal nerve consists of postganglionic parasympathetic fibers for the gland. Then sympathetic fibers, the postganglionic superior cervical ganglia, and through here you can see the lesser petrosal nerve to be traced here. Lesser petrosal nerve, there is a groove even over the petrous part of temporal bone, and around the here you can see the auriculotemporal nerve can be traced here. This is the plexus, tympanic plexus, internal carotid artery around which there are plexus, and this is a cauda tympani through the cauda tympani, and through the auriculotemporal nerve. Finally, they will reach the gland. So here also the pathway is shown in the diagram. Then the structures which enter the facial nerve, retromandibular vein, and the external carotid artery simply, and the structures which exit facial nerve and its branches, terminal branches of external carotid artery, branches of retromandibular vein, and the parotid duct which exit. Regarding applied anatomy, the mumps usually infection of glands leads to swelling and pain during the mastication, and spread of bacterial infection is the reason, and from mouth via the duct. And viral do not separate. If it's a viral, do not suppurate. There is no suppuration. And parotid abscesses. Drainage through the horizontal incision is called as Hilton's method. Parotid abscess can be drained with a horizontal incision. And mixed parotid tumor, slow growing and benign and painless tumor usually observed. Does not involve the facial nerve. And the Fraze syndrome is a complication. Penetrating wound damages auriculotemporal and great auricular nerves. So during healing, there's a mechanism here which we have to understand. Secretomotor fibers of auriculotemporal nerve join with the distal end of the greater auricular nerve. Secretomotor fibers of auriculotemporal nerve join with the distal end of the greater auricular nerve. The fibers reach the facial skin. Posteriorly, mastoid, anteriorly, angle of the mandible. So these two regions. Between these two, during eating, beads of perspiration occurs. This is called as Fraze syndrome. The reason behind is the stimulus intended for salivary secretion produces the sweat. Actually, there is a need of salivary secretion. Because of this, auriculotemporal nerve is joining with the greater auricular nerve, so it's leading to sweating. So then parotiditis, inflammation of the both glands, and the salivary stones at confluence of duct. The stones can be observed. So this is about the parotid gland. Mainly the structures which are entering and leaving is important. It's a shape, inverted pyramid shape it has, and it has its surfaces anteromedial, posteromedial. The base and the apex, anterior border, posterior border, and the medial border with its pyramidal shape. And we have to remember the structures which are entering and which are leaving the parotid gland. And thank you very much.